Let's go.
Welcome to the Integrative Edge, your go-to podcast for fresh perspectives on holistic health and functional movement. Join us as we explore innovative ways to optimize your health naturally and sustainably.
I'm Kelly Demers, founder of the Integrative Wellness Coalition and the owner of True North Performance.
I'm Lindsay Seefeldt, Doctor of Physical Therapy and owner and operator of Uplifted Oncology Rehab.
I'm Dr. Kym Clinic, licensed pharmacist and owner of Innate Healing and Performance.
You can find the show on Spotify, Apple Podcast, or wherever you get your podcasts. Subscribe so you never miss an episode.
Welcome back to the Integrative Edge, your podcast where we explore innovative ways to optimize your health naturally and sustainably. I am your host, Kelly Demers, and as always, I am joined by my two incredible co-hosts, Dr. Lindsay Seefeldt and Dr. Kym Clinic. Today's episode is especially meaningful. We're kicking off a new series spotlighting members of the Integrative Wellness Coalition. That is, if you're not familiar with it, is a dynamic network of practitioners that have banded together and really are committed to restoring health starting at the root. That's actually the tagline for the coalition. It is my pleasure to welcome our first featured guest to the Integrative Edge, Michelle Greenheck of MG Physical Therapy and Wellness. Michelle is a licensed physical therapist with specialized expertise in pelvic floor health, vestibular rehabilitation, and women's wellness. Michelle, welcome to the Integrative Edge.
Thank you so much, Kelly. Thank you guys for having me. I listen to you guys frequently, so it's an honor to be here joining you guys today. Just a little bit about myself. I've been practicing PT for about 10 years now. I got my doctorate in PT just over a decade ago, and I've practiced in a variety of settings, but just recently started my business, MG Physical Therapy and Wellness, and it's a mobile practice. So that's been fun. That means I travel to my clients for their convenience. And as you mentioned, I do have some specialty training in vestibular rehab and pelvic floor rehab. So that's most of my clients that I see.
Awesome. Well, today we're going to focus in on pelvic floor and that it's not just for postpartum women. First things first, Michelle, can you define the pelvic floor and explain why it's so much more than just postpartum care?
Yeah, absolutely. So the pelvic floor is a group of muscles actually that sits at the base of our pelvis. And I like to tell people it's kind of structured like a hammock. And it functions as the base of our core. So I always use the analogy of like a soda can. If you think of a soda can, the very bottom of that can is going to be the pelvic floor. The top is going to be the diaphragm, and then the surrounding area is your transverse abdominis. So it plays a role in supporting our internal organs, bowel bladder control, sexual function, and core stability. And yeah, most people think that pelvic floor care is just for postpartum women, which makes sense because the pelvic floor does go through a lot of trauma with birth. But it actually affects everyone. Everyone has a pelvic floor, everyone of all ages, genders, and actually 70% of athletes have pelvic floor issues. So I always like to tell people that it's not just postpartum that needs that love.
Perfect.
Very cool.
For listeners of all ages and backgrounds, and you kind of hit on this, everybody has a pelvic floor.
Yeah.
What are the signs or symptoms that might indicate pelvic floor dysfunction, even if they've never had kids?
Yeah, so I think one of the most common ones is incontinence, which is leakage of urine. We see a couple types of that. So a lot of clients will say that they leak urine when they're laughing, coughing, sneezing, anything like that. Also just not being able to get to the bathroom in time, which we call urge incontinence. Something else could be constipation, pain with intercourse or bowel movements, or just generally feeling heavy in the pelvis can indicate pelvic floor dysfunction. I also like to tell people if you have low back pain or tailbone pain that you've been treated for and it's not getting better with traditional therapy, it might mean that pelvic floor is involved.
Yeah, it's interesting because I think for a lot of women that have incontinence or, especially we see it like in here if you're jumping rope, right? Mm-hmm. Like, like that's a normal thing. And it's not, it's something that is Absolutely. Fixable. It shouldn't be the norm. I think we've accepted it as the norm, but it shouldn't be that way.
Absolutely. No, I completely agree. I think I go to a workout class. It's a high intensity interval training, and people joke all the time about it. And I always say it's fun to use humor. I'm glad that we can like normalize it in that sense.
Right.
Meaning like, hey, it's common. You know, a lot of people struggle with that. But I always tell people incontinence is never normal. So even if you're jumping, and even if your friends at the gym are struggling with it, it's not normal, and it's something that can be addressed.
Yes.
Well, that's something we say a lot in here anyway. Just because it's common doesn't mean that it's normal.
I was just thinking the same
That's like
thing.
our whole podcast.
Exactly.
It should be the theme of most of our podcasts. Normal does not mean, or common doesn't mean normal. I'll throw this out to the group. How does pelvic floor health influence posture, movement, stability, lower back comfort? And I know, Lindsay, you probably have some experience in that as well.
Yeah, so obviously I don't have the in-depth training like Michelle has, but I mean, that pelvic floor, like she said, is incredibly important for stabilizing a lot of different things in our body. Like that is the root of everything. And, when it comes to, like the lymphatic health that I talk about, even oncology, that pelvic floor can be really affected, with all the different traumas. Let's go to cancer. So if someone has some kind of trauma with cancer, surgeries, radiation, the chemotherapies, it can really weaken that pelvic floor. And it's hard to, I think, have that discussion. I think a lot of people are embarrassed, right, Michelle? Like, I feel like, sometimes it's like the last thing people talk about, when they're starting, they're having issues in the bathroom, like leakage and bowel obstruction type things. And it's hard to talk about that, I think, at least in my experience. Absolutely. But definitely with the cancer realm, and then, lymphatic health, like, we talked about, this is where we eliminate everything. And we need to have that structure very sound.
Mm-hmm. I'm going to throw this one out to all three as well. But from your perspective in integrative health, how do you weave pelvic floor care into broader functional protocols?
Yeah, I think like going off of what Lindsay was just saying with kind of posture and everything and how it impacts it, I think for me, I'm always looking at kind of that whole person, and we want to make sure that, when we think of pelvic floor, it directly impacts posture. If we just think about how the pelvis tilts, so we get a lot of people that'll sit with kind of that forward pelvic tilt, and that's actually going to kind of overstretch the pelvic floor. And so I always want to make sure I'm focusing on posture, not just like localized pelvic floor, because when you think about something that's overstretched, if you think of like a rubber band, if it gets too overstretched, you lose that elasticity, you lose that function of it. And then on the contrary, if we kind of bring that pelvis backward, then we're gonna tighten the pelvic floor too much, and that's gonna cause issues as well, because when a muscle's stuck very tight, it doesn't have a lot of ability to kind of tighten more and strengthen. So I'd say I definitely incorporate that posture, and then diaphragmatic breathing is another huge one that you guys can probably speak to a little bit more. I know you guys spoke a lot of that.
Breath work,
right?
Breath work makes an appearance in every podcast,
Yes.
and I love it.
Yeah, absolutely. So I think for that, the pelvic floor actually relaxes. When we inhale, it expands, so we can use that as well to kind of weave it into those broader protocols.
So it's interesting, because that was kind of my follow-up question was, what complementary strategies like targeted breath work, mindfulness, nutrition, do you find amplify pelvic floor outcomes?
Yeah, I think breath is the number one. Because again, a lot of clients that I see that are having issue with the pelvic floor have a really difficult time, A, just finding the pelvic floor, and B, being able to relax it. So we always think about pelvic floor rehab as like Kegels, 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 but it's really more important that we first are able to find that pelvic floor and relax it, and that's where that breath work comes in. Because again, when we are able to do that diaphragm breath in, that pelvic floor expands and relaxes. So I'd say that's a big one.
Yeah, I was going to say, like Michelle and I were talking like before we recorded this episode even, and just maybe about a potential mutual client. And for me, I see this area of practice as really foundations. Like most clients, like they should be thinking about some of these foundations before they're even kind of coming to my practice, I would say, in like functional medicine, because I don't want to promise clients like that, supplements and like that route is going to cure all their problems, when it could be a structural thing, and those foundations like really need to be in place. And even in my practice, I have like a foundational like health and wellness document that I give every client kind of even after our first discovery call. And I'm just kind of like, we need to have these pillars in place first to make sure that groundwork and that foundation is laid, because we don't want to be working against the grain with everything. And so that's like with pelvic floor, that seems to me is definitely like a foundational element, right? You've got to have a strong foundation to begin.
For sure.
Yeah, I was just going to say too, adding to this, I know you guys have spoken episodes too about the importance of hydration. And I think one thing, like I mentioned, one of those common symptoms that people will experience with pelvic floor is incontinence. And so then what do? Oh, I'm just not going to drink anything.
Yeah.
Right.
Thinking that will be the solution, but actually concentrated urine is a bladder irritant. So we notice that they're actually kind of exacerbating that issue by not drinking enough. So I think I can't speak as much to the nutrition aspect, the food, but as for hydration, definitely that plays a huge role.
Yeah, and then it leads to constipation issues too, right? So if you're not hydrating appropriately, then your bowels are going to slow up too. But that's exactly what I see too when people are complaining of, the leakage and stuff. It's like, okay, they almost like feel like, oh, I just didn't have anything to drink today because I didn't want to go pee all day long. But that is...
Or then it can like exacerbate into like infections, like you said,
Yes.
concentrated urine and other things. So it just like leads to further complications.
Everything is connected.
Yeah.
Right? So building on that, so hydration is important. What are some other practical exercises or daily habits that people can incorporate to support pelvic floor?
Yeah, absolutely. Did we mention breathing yet, you guys?
I was like, we should, Michelle should give us like a couple ones we could link in the show notes or something just for people. Because I get that question a lot too. They're like, do you have any like
Practical
like little videos or things I can do for, because I, even in my practice mentioning breath work, like, because people talking about anxiety and other things, I'm like, okay, you got to give yourself a little bit of a moment in your day to like focus a little bit on breathing and just oxygen to your cells in your brain.
I agree. I think it's so interesting. It's probably one of the most underrated tools in the arsenal is breath work. You have it available to you 24/7, and people will reach for just about anything else first. And I'm like, if you just take a step back and we do the breath work, I swear it works. And when it does, they look at me like, well,
That's it?
Yeah, right. It's really
That's all I had to do?
Yeah, it's always those aha moments, but breath work is so important.
It really is. It's linked to everything. And I think even like 10 years ago when I was in school, they talked about breath work, and I'm not going to lie, I kind of poo-pooed it. I was like, oh, no, I want the big things, these big changes, right? And it really is powerful. And you guys do a great job, I know, at True North too, with the square breathing and or the box breathing, I should say. But yeah, going back to pelvic floor, diaphragm breathing again, being able to kind of master that, incorporate it into your daily life is going to, again, help you to be able to relax that pelvic floor. Some other practical things, daily habits. I work with a lot of athletes too, and I think a lot of people are aware of this, but when you're doing the more challenging part of a lift, you want to make sure you're exhaling because that's actually going to activate your transverse abdominis and also your pelvic floor, because the pelvic floor contracts with it, which is kind of cool. So I always tell people, think about exhaling when you're lifting something heavy or doing a weight lift. The other thing is posture, like I was kind of talking about before. I kind of liken the pelvis to a bowl of soup, and I talk about kind of spilling that soup out the front, spilling that soup out the back.
That's a great analogy.
I like these analogies.
Yeah, I like analogies if you haven't noticed. But that can really help, because then when you kind of keep that soup right in the middle, that neutral pelvis is kind of where we want to hang out. We want that mobility, but being able to like get in and out of that forward, backward tilt, stay right in the middle is really good, because again, that's where that pelvic floor is going to work optimally. So those are just some practical.
I'm like practicing here.
I know.
Are you guys doing it right now?
go.
Yeah.
And, you know, talking about, like, we talk a lot about females, I think, with pelvic health, but males too. Like, you think when you talk about the inability to, like, you know, the soup in and out, I think men have extremely poor pelvic mobility. And so, you know, just that might be a good starting point for even males, is to try to get, like, that pelvis moving, because, you know, like I said, that's the foundation. And so if that is so stuck, everything, like, around it is going to be stuck.
Is that helpful for, like, their, you know, prostate health and things like that? You know,
Yeah.
I think about that, because it's a lot of, it's a common symptom I'll hear from clients, older male clients, just, you know, just concerns about prostate health. And
it's the same thing. If that pelvic floor is so tight, it's holding to the prostate. It's keeping everything really restricted. So it's very important to figure out ways to get that pelvic floor moving. So I love the Swiss ball. So getting, like, that big exercise ball, like a lot of people that have issues with moving their pelvis, that's usually where I'll start them, is get on a ball and start, you know, experimenting ways to move that pelvis different directions.
Yeah, just drawing, I love that, just drawing attention to that area. I think we're also, like, used to, I can do a bicep curl, I can move my legs, but we don't always think about moving the pelvis. And so that can be really powerful. And I always tell people too, if that is too intimidating for you, even just moving through your mid-back, like doing some cat camels, just getting general spine mobility. As we all know, everything's connected, right? So even if we can start some mobility up there, that helps too, so.
That's great. If someone's listening, when should they get evaluated? Like, what red flags or functional limitations indicate that there might be something at play?
Yeah, so I think a big one, again, like we mentioned earlier, incontinence. So it's never normal. It's not uncommon, but it's never normal. So if you are leaking urine when you're exercising or with anything, any daily activity, that's definitely a sign to get some help. Also, pain with intercourse. That shouldn't be painful. So definitely can get some help there. Or if, again, you're feeling any of those symptoms I mentioned earlier, heaviness in the pelvis or low back pain, again, you might have been getting treatment for that, and the pelvic floor might have been missed. There's a lot of amazing therapists out there, but not everyone has that specialty training in pelvic floor. So that's one way. If you're like, you know, I've been working on this, it's just not getting better, that would be an indicator to maybe see a pelvic floor specialist. And then I always say this one, when Kegels just aren't cutting it anymore. So that's, I think, a lot of women I know, at least postpartum, you know, they're like, I just have to do some Kegels. And that's not the case. In actually the majority of cases, we're actually just kind of tightening things more when we really need to actually learn to relax first and then contract. And a lot of times too, we see people doing Kegels that they're not effective. They're actually, like, squeezing their butt, squeezing everything else but the pelvic floor. So yeah, when you just feel like what you're doing isn't cutting it for your symptoms, see one of the pelvic floor therapists.
What about, like, I'm just, like, thinking of other, like, women's health conditions too, because there's a lot of clients that I see who have, like, hysterectomy or like laparoscopic endometriosis surgery. I always think of that in my particular case. But there was no discussion about things like this post-op. I mean, I'm always talking to women about, like, progesterone when they get, you know, their uterus removed and stuff like that. But what about, like, those types of scenarios? Like, would those clients benefit from, or patients kind of benefit from things like this?
Yeah, I'm really glad that you brought that up, because in my personal case too, when I had a C-section with my first and then I did vaginal for my second, I didn't really at that time do pelvic floor therapy, so I didn't see the benefit. I shouldn't say the benefit, but I didn't do it. And I could have used it so much, because when you go through any type of trauma, like you mentioned, hysterectomy or just local tissue trauma, what happens is that neuromuscular connection, so the connection from the brain to that organ itself, to those tissues, is compromised. And we can kind of get them talking a little bit better again, but it does take work and therapy. So I think absolutely that is a population that should always have pelvic floor therapy. In fact, I think especially for postpartum women or women that undergo any type of laparoscopic surgery, I think that pelvic floor therapy should be the standard. Because again,
Yes.
It's so
Well, it is in other countries, right?
It is,
pelvic
which is so
floor
sad.
coaches,
It's automatic.
Post, labor, maternity.
I didn't even know that.
Yeah, we are one of the only countries that don't have a pelvic floor
didn't know
assigned.
that.
It's the norm in other countries. Yeah,
Yeah.
it's like 6 weeks
shocks
of
me.
pelvic floor therapy
my
is
goodness.
automatic. And I know, and it's funny because
Come on,
And it's
America.
like 6 months.
Yeah.
It's 6 months
Yeah.
of that you have a pelvic floor coach following the birth of a child, except for the U.S.
Of course. Yeah, and I've worked with women too. And again, I want to emphasize too, pelvic floor therapy is not just for postpartum women, but we do
Yeah.
talk about it
Yeah.
a lot because it is a really common population for
Yep.
good reason. But I've seen women that are in their 60s that had children over 30 years ago that are like, they get better in a couple sessions just because they needed to refine their pelvic floor. And it's really sad because it's like, they've been experiencing these symptoms for 30 years.
Right.
And had we just, done a little rehab after, probably would have had a different outcome.
For sure.
Yeah.
So it brings me to my next question, whether it's women that are older, somebody that's maybe struggling, a male, how do you support someone that comes in and might feel embarrassed or unsure about raising concerns about pelvic floor?
Yeah, I think, again, I like to emphasize to people that it's super common. And I always use this statistic, about athletes. 70% of athletes struggle with pelvic floor issues. So it's not uncommon, so you don't have to feel alone, but it's also not normal. You don't have to deal with it. And one thing as a physical therapist, and I'm sure, Lindsay, you can speak to this too, I always do a lot of screening questions to try to make it, like, I almost bring it up, like, oh, do you have any issues with this? Because a lot of times people won't volunteer that information, but maybe if I'm seeing them for something else, like just low back pain, I'll ask, oh, do you have any issues with incontinence or pain with intercourse, things like that, and just kind of giving them the opportunity to bring it up. And I think not rushing it. I think sometimes people just need a little time to get comfortable. But I also want to put it out there that pelvic floor therapy does not have to be invasive. It doesn't always include internal work. So I think there's so much we can do externally and with the breath and with using other muscles that co-contract. So it really doesn't have to be scary.
Yeah, I think you have a unique, with your work, you work with people in their home, so I think, being such a personal thing, I think being in your own home environment and being able to talk about that in their own environment is probably very comforting, I would assume. So that's really cool that you offer that service.
No, I love that. That's one of the reasons I wanted to offer that too. I mean, the other client population I see a lot is dizziness, so it can be hard to get out of your home, and just pelvic floor. It's like, who wants to go to an office that's foreign to them and talk about that, right? So, yeah.
Michelle, if someone is looking for a qualified pelvic floor therapist, they can come to you, certainly. If someone is listening that's maybe out of the area, how do you go about finding a qualified pelvic floor specialist?
Yeah, that's a great question. So, you can always look at, if you already have a physical therapy clinic you're familiar with and you like, you can actually look, they'll often list their specialty providers. So they'll say if they have a pelvic floor specialty. Another way, you can just look through the directory, through the Herman and Wallace Institute. That's a great website. So that's Herman and Wallace Institute. And then also the APTA website has a bunch of specialty providers listed as well. So you can find one in your city.
That's awesome. Final thoughts, comments?
It doesn't have to be the norm, right?
Yes.
I think that's the big takeaway that, incontinence, leaking, that does not have to be the norm. If you're struggling with this, like this can be addressed. We can fix this. We can help this.
I agree. I think we could start every podcast with that same statement. Just because it's common doesn't mean it's normal.
Right.
Michelle, thank you so much for sharing your expertise with us. It sets a powerful tone for everyone that's coming from the Integrative Wellness Coalition in future episodes. To our listeners, we found out that pelvic floor really transcends any stage of life. So if this episode resonated with you, please leave us a comment, share it with your friends. If you haven't already, please subscribe. We are on Apple Podcasts, Spotify, or wherever you get your podcasts. Thanks so much. We'll see you next time.